Massachusetts College of Pharmacy and Health Sciences was founded in 1823. MCPHS offers undergraduate, professional... And you'll be on your way to an exciting, fulfilling healthcare education and career.
I am Ashley. I am from Upton, Massachusetts. I'm a fourth-year pharmaceutical and healthcare business student, and I'm here at MCPHS. I fell in love with the program because it's a hybrid between pharmacy and business. I love the fact that MCPHS is in Boston because it is just such a hub for all things that are medical. There's so many hospitals around and pharmaceutical companies and biotechs and just all of these businesses that hire students from MCPHS due to the awesome reputation that the school has. My dream job would be to work for a pharmaceutical company in the regulatory affairs department, bringing new drugs to market.
Hi, I'm Brian. I'm from Hobart, Massachusetts. My program is biomedical informatics, and I'm a student at MCPHS. My first 2 weeks, they were very surprising. The transition from high school to college. The faculty cares so much about you. They really want to see you do well. They really want to see that you know the information. If you can't make it to their office hours, they'll make time. They'll go out of their way. I love this place so much because of the opportunities that we have in all the hospitals, all the research clinics. And through that, there's so many opportunities after you graduate here to find a new career and start your life.
I chose MCPHS for a couple of reasons. The main one is because of the countless opportunities that I have here. I've always wanted to come to Boston, so that was great. and I like the small school size because I get the individual attention that I need. Boston has some of the best names in hospitals. I want to be a pediatric nurse, and the #1 children's hospital is literally a 5-minute walk from MCPHS. My professors here at MCPHS are really awesome. A lot of them have been nurses for a really long time, and a lot of them also come from different countries, so we have a lot of different really interesting nursing perspectives. I would not have picked a 4-year program over a 3-year program just because of the advantages that it has for me. The nursing market is booming right now, and when I graduated high school, that's what everyone was telling me, so I know so many people who went into the nursing profession. They all went into 4-year programs, and I went into a 3-year program, so I'm gonna be able to get into the field a year before they do. My dream job is to be an ICU nurse at Boston Children's Hospital.
My name's Christine, and I'm from Drake, Massachusetts. I'm in the Accelerated Diagnostic Medical Sonography program here at MCPHS. So an accelerated program cuts out basically a year of school. So instead of going to school 4 years for my bachelor's degree, I only go to school for 3 years. It's really great because our students get to volunteer, do internships, and do their clinical rotations at world-known hospitals. A lot of our students actually get job offers at their clinical sites before they even graduate. I really love Boston and the area. I love the energy here. It's kind of fast-paced. Everyone's really excited to be here. It's very much a college city, so wherever you go, I feel comfortable because there's college students all over the place.
My name is Danielle. I'm a student at MCPHS in the Diagnostic Medical Sonography program in Worcester. I actually have a bachelor's degree in public health, and I'm looking at MCPHS in the Diagnostic Medical Sonography field to extend my studies. So the DMS program has 2 tracks, Echo and General, and I'm in the General track. Our professors are great. They're always there to help. You know, they'll come in on a Saturday if you need them to. We have open lab Saturdays. They switch off between Boston and Worcester. We had a patient come in last week, and she knew she was pregnant but did not know it was with twins, and we were the ones to tell her. She was very shocked. The MCPHS currently has 100% job employment rate for the DMS program.
My name's Erin. I'm studying dental hygiene at the Worcester campus at MCPHS, where I'm in the post-baccalaureate program. I'm originally from Braintree, Massachusetts. Currently, I'm living in university-sponsored housing. It's only a few blocks away from campus, so I'm able to walk to class every day, and I'm living with my roommate, who's also a student in the dental hygiene post-baccalaureate program. My dream job was to get a career in dental hygiene where I go into office and see a variety of patients. I don't just want to be stuck in the same old routine where I'm seeing the same easy, typical patient. You know, I really want the experience of seeing anyone from a child all the way through an adult or geriatric patient. So I think the best thing about this program is not only the great instructors and professors that you're going to be having in your classroom as well as in the clinic, but also the friendships that you're going to make among your peers.
I'm Jessica, and I'm in the Pharmaceutical Sciences program here at MCPHS. I chose MCPHS because I liked a small school. I also liked the fact that it was in Boston. I really thought that Boston was a place to come because there are so many hospitals around and so many opportunities, and because MCPHS is in the middle of all of that, you just really get a chance to be immersed in everything. It provides such a good learning experience just being around all of this stuff. You see doctors and nurses and dental hygienists and healthcare professionals walking around, and I feel inspired because I see what I can do after school.
So I chose MCPHS because it is one of the few schools in New England that offers a 3-year accelerated bachelor's degree program for dental hygiene. So we can get out in the workforce earlier, and a bachelor's degree also leads us to different pathways that an associate's wouldn't. After I get my bachelor's degree, I'm interested in also working not only in general practice, but also doing a specialty in exotic animal dentistry. I'm a perfectionist. Dental hygienist and a perfectionist. You want want to make sure that you gave not only the best care for your patients, but you want to make sure that they will not leave with anything that's left under their teeth.
Hey guys, my name is Steven Kamara and I'm from New Hampshire. I'm currently a Pharmacology and Toxicology senior here at MCPHS. Pharmacology and Toxicology is an area where we study how the drug affects the body, both positively and negatively. Being in the Longwood medical area really provides the opportunity for anyone to get into research. The program here, for my class here, being a senior, there's only 6 of us, and we have 4 different professors, all at the PhD level, so the learning that we get is really hands-on. The current internship that I'm part of is at the Wyss Institute, which is a part of Harvard Medical School.
Hi, my name is Steve. I'm a 5th year pharmacy student from Long Island, New York, here at MCPHS. So currently I'm doing some really great research with one of the faculty members here at MCPHS. It is a research in which we're studying rheumatoid arthritis. The reason why research is so cool is because you essentially are pioneering things that we have no idea about and setting up the groundwork to produce new knowledge within the scientific community. And that may directly result in a cure for whatever disease we're interested in. That passion that you really see from the faculty members and the relationships you build with the students just makes it feel like my second home.
Hi, I'm Nardine at MCPHS. I'm a junior in the Health Sciences program, and I'm originally from Newton, Mass. I'm very excited, wicked excited, to start my first internship next semester at Mass General. It will go towards my work study elective in the Health Sciences program, so I'll get credit for it, and I get experience with it, and I buff up my resume with it. I chose to come to MCPHS because it's easy for me to commute, and also my sister came here and told me about all the great things and opportunities that came with being a student at MCPHS. The best thing about going to school in the city is that you'll never be bored. Good environment to be in. It's really pretty, it's homey, everybody's very friendly. Your classes are not overwhelming. You'll always have someone who's in the same boat as you, so you can kind of vibe off each other and comfort each other, and it's a good school, so come here.
Hi, I'm Tiffany. I'm a 3rd year studying public health. I'm from San Francisco, California, and I'm right here at MCPHS. I love what MCPHS has to offer. 3 of the biggest hospitals are here, Boston Children's, Beth Israel, and Brigham Women's Hospital. So you definitely get a lot of healthcare that surrounds you and people that you could definitely work with and work for. I actually originally started out as pharmacy. And then when I first heard about public health, it was a new major when I was a freshman. And it kind of had everything that I wanted. I think I want to focus on water sanitation and accessibility too. So I think that's a huge need, and public health really brings to light a lot of those issues as well. I want to work for a nonprofit, and yeah, I definitely want to work overseas and focus on global health.
Hey guys, come on in. My name is Morgan. I'm a freshman at Mass College of Pharmacy and Health Sciences. I'm up here on the 5th floor in Matricaria, and I absolutely love this dorm. You know, it's like my own apartment, first year of college. What else could I ask for? As you can see, I have my own living room. What other college kid has their own living room? And, you know, my kitchen table when I cook dinner. And yes, I did say cook dinner. You know, I come to my kitchen, and, you know, at home, I love home-cooked meals, so I don't want to leave that when I go to college. If I want to take a shower just to relax, I can come to my own bathroom, enjoy my own privacy. I don't have to go down the end of the hall and share with 100 kids on my floor. It's great. We come into my room. This is actually my favorite place in the entire dorm. I can do whatever I want. I can bring all my favorite things from home. And then my own bed. You know, it's high up. I can put stuff underneath it, so it's great. It's a great storage. I have my amazing view of Boston, the Prudential Center. It's unbelievable. You know what? I want to change the scenery. Let's go up to the lounge. Hey. This is a great place to hang out. Thanks for coming by. I had a really good time, but I gotta go to lab now. I'll see you later. Bye.
Welcome to Phenol 805. Come on in. My name is Eric Paul, and I'm a student at MCPHS. It's a nice little homey space I have here. Little something on the wall. Here's my bed right here. This is where I study. This is where I get all my work done. Me being intense. Another great thing about living in Phenol Hall, view. Check that out. You get to see the Prudential building all the way out there. Who else has a view like this? Got my roommate's stuff over here, you know, his workspace. I guess I'll show you the kitchen now. Let's go check it out. Food, I like it. Cook here, and we all clean up after ourselves. Let's check out the lounge. Phenol Hall is really cool because it's right on campus. I can wake up 15 minutes before class and I can head right over to lab. So thanks for stopping by. I gotta write a lab report, so you gotta go. See ya.
Hey, welcome to the treehouse.
Hey, what's up? I'm Paige. Welcome to my room. So this is basically a suite. This is the triple. We have a double over there. This is my bunk. I actually really like the top bunk. It's a lot more fun. I kind of like looking down on my roommates. All right, so this desk chair, you know how it's just normal desk chair, but it actually becomes a rocking chair. So there's plenty of room for everything. We kind of just sit here and chill all the time, study together. It's all set up really nicely. We can even fit all of our clothes. My mom didn't believe me I would be able to fit all my clothes here, and I definitely could. If you want, I'll show you the lounge. You can come with me. This building has 20 floors, and each lounge is a different color, all to match the colors of the crayon box. The treehouse was built really energy efficient, so this light tells us when we can have our windows open or closed for climate control. This is the kitchen on the 3rd floor. As you can see, there's a lot of space for everyone to eat and hang out. We make cookies all the time and everyone will sit around and eat them. This is the 3rd floor lounge. As you can see, we have a big screen TV. I'm here all the time to just hang out and study and play pool or hang out with friends. All right, guys, well, I have to go to class, but I'll see you later.
Hey, what's going on? Come on in, this is my apartment. And this is my room. Hey, I'm Simon. I live in an off-campus apartment. You can see I got my study space going on, and you know, there's a lot of classwork that has to get done, so it's good to have a good study space. Okay, so this is the kitchen. It's great to be able to have some cooking time. It saves money not ordering takeout. We can do our own meals. This is our living room where we kind of hang out. Sometimes we have some a little bit more intellectual games. Sometimes we have something a bit more mindless and fun. So we left our holiday lights out, but we thought that's okay because you know what? Every day's a holiday when you have your own apartment. A lot of college students have a guitar hanging around their apartment, but mine's not just for show. If you're going to MCPHS, you should really have an apartment because it's the best way to experience Boston.
The Esther M. Wilkins Forsyth Dental Hygiene Clinic at MCPHS is one of the leading educational facilities for the dental hygiene profession. This modern facility is equipped with state-of-the-art dental technology and provides students with a complete, immersive professional experience, including the treatment of real patients. Student hygienists provide preventative dental care to a diverse population of patients from the college and the community. The clinic is equipped with 24 operatories featuring ergonomic patient and operator chairs, a dental materials laboratory, and several radiology rooms. Student hygienists have advanced technologies such as intraoral video cameras to help them evaluate patients, digital radiologic imaging, and digital panoramic technology at their disposal as they learn and actually practice hands-on, high-quality dental care. The Diagnostic Medical Sonography Laboratory at MCPHS features some of the most advanced imaging technology available. Students learn the art and science of medical sonography by scanning each other and getting a first-hand view of the internal systems they will learn to visually master through the use of this highly sophisticated equipment. The DMS lab features 12 bays with multiple workstations. There are 5 specialized cardiovascular units and 5 general sonography units, all utilizing state-of-the-art 3D imaging technology. There are also 7 portable sonography units. Students training in this lab become proficient in the use of equipment found in the most technologically advanced medical facilities and become vital to the successful diagnosis and treatment of patients by providing a clear view of what's happening inside the body. The Nuclear Medicine Technology, or NMT Lab, is a comprehensive facility designed to provide a complete, immersive learning experience for students studying this cutting-edge medical specialty. The lab features a state-of-the-art SPECT gamma camera that students train on and learn to operate with professional precision. There are 4 laboratory demonstration counters where all aspects of nuclear medicine are studied. The lab is equipped with multiple radioactive sources, 2 nuclear medicine processing computers, and multiple syringe shields for the preparation of radioactive medical agents. Students learn to process and administer radioactive medicines in an environment as technically advanced and as exciting as the professional settings that await them when they graduate. The Physician Assistant, or PA lab at MCPHS, is designed to provide the most comprehensive hands-on learning experience available. The recently expanded lab is an optimal environment for future medical professionals as they master diagnostic skills, treatment skills, and all aspects of quality patient care needed to be successful in this challenging and exciting discipline. Students engage in hands-on procedures on real people in a high-tech professional environment overseen by experienced expert instructors. The lab features medical bays outfitted with state-of-the-art integrated systems, equipment, and technology identical to that found in medical settings like doctors' offices, clinics, and hospitals. So the PA students are totally prepared to take on whatever awaits them in the professional world. The Clinical Simulation Lab at MCPHS is an immersive, hands-on learning environment where nursing students learn all aspects of patient care. Located at the Richard E. Griffin Academic Center, the lab features a full ward of advanced computerized mannequins that simulate actual human patients extremely accurately, with breathing, heartbeats, and other functions that allow for the creation of real-world medical scenarios. Students in the lab learn to execute over 100 skills, from assessment all the way to emergency intervention. They're instructed by professional nurses from many specialties, including nurse practitioners, medical, surgical, intensive care, emergency, maternity, and pediatric nurses. The same integrated diagnostic systems found in actual hospitals are at the students' disposal as they are trained to complete full head-to-toe examinations and react to the countless types of possible medical situations awaiting them when they start their careers. Every MCPHS undergraduate student will spend time in the chemistry lab, where they're immersed in the fascinating world of science. Students put on lab coats and enter the laboratory to learn and test the innumerable scientific principles that are the building blocks of the knowledge they will rely on in the professional world. The Matricaria Chemistry Lab is modularly designed and comprises 5 self-contained work pods that can accommodate 16 scientists each. There's also a separate advanced lab reserved for upper-level chemistry practice. While up to 100 students can work at once, the design of the laboratory allows for small groups to work independently on individual experiments, with an instructor assigned to each pod. Students constantly interact and compare results in this open layout. Instructors and professors help students conduct many exciting experiments, and they constantly circulate through the lab to provide guidance. Students in the lab confirm the many principles they learn in lecture and see the results with their own eyes.
Hi, how are you?
Good, thanks. I was wondering if I could get a flu shot today?
Yeah, sure, we offer flu shots. Hey, Laura, can you give a flu shot?
Sure. I'll just have you come over here and take a seat.
Great.
All right. So I'm actually just going to have you fill this out. It's going to ask you some questions about allergies, if you have any allergies to eggs, if you don't feel well today, if you've ever gotten the flu shot before. So I'm going to give this to you. Okay, so it's just going to be a little pinch, okay? All set. Okay, you're all set. So I'm just gonna have you hang out here for a couple of minutes while I run this through.
Great.
This is not just a pharmacy, it's a classroom. Welcome to the pharmacy program at Massachusetts College of Pharmacy and Health Sciences.
How did it go today?
Good. Pretty well, yeah.
Excellent. I was watching from over in the corner there, and the observation looked excellent. How about yourself, Christine?
But I made a parenteral solution today, and I worked on my aseptic technique as well, so it went pretty well. A PharmD is a Doctor of Pharmacy degree. It's a 6-year program, and you come out with your doctorate. So when I do graduate, you can call me Dr. Gillis, technically, which is very cool.
So it's different from a medical doctor. Basically, our responsibility is more with the drug side of things, whereas a medical doctor is more like diagnosis type things. But we are the experts in drugs.
I have to say your shot and technique was right on point.
Thank
nice
you.
Nice job, Laura.
Thank
I want them to feel comfortable. And our goal is to get these students to be comfortable with these applications. How do I walk out of these doors at the end of this semester, at the end of the year, and how do I apply that onto my practice in the advanced therapeutic rotations?
Well, I didn't know that I wanted to be a pharmacist all along. It wasn't something that I had in mind when I was a child, but I love the pharmacy profession. Being a pharmacist isn't just standing behind the counter. There's so many other aspects to it and so many different career paths that you can take. My sister went here for nursing and she graduated 3 years ago. And it was my mom who discovered MCPHS. And so we came on a tour and I fell in love with it. I thought all the labs were really cool and I sat down, thought all about it and started actually shadowing a pharmacist. I just knew it was for me.
So I'm in the honors program, and this is the very first year that a school actually has an honors program, so I'm very happy to be into that. There's about probably 50 people applied, and they only took about 10 people. My parents were pretty excited when I got in.
The honors program is for highly motivated, academically talented students that are looking for an opportunity to go beyond what they're doing in the PharmD program.
There is a lot of homework. It's a lot of material they throw at you. People record the lectures and stuff like that, and they have to go back and listen to it because you can't write everything down. You have to make sure that you prioritize your time accordingly in order to make sure you learn everything. You don't want to procrastinate, wait till the last minute, and then try to study. Otherwise, you obviously won't understand it. I'm a 4th-year PharmD student.
I'm a 5th-year PharmD student.
I'm taking organic chemistry, pathophysiology, biochemistry,
General chemistry,
pharmaceutics,
medicinal chemistry,
pharmacology,
biology,
biotech,
evolution of the healthcare professions, interpersonal communications.
The 6th year is basically like the pinnacle of your pharmacy student career. So basically, you're done with classes, you're done with exams, so you're going into different settings in the pharmacy field. But I was driving to rotation the other day, and I was just like, this is what I'm going to do, and I was so excited about it because it was fun. Like, the day is actually fun. Now that it's not just test taking and worrying about knowing everything, now I know it, and now I'm just putting it into practice and interacting with people, and I just can't believe that I'm going to get paid for that.
I've been working in a hospital now for about 3 years, and I've been on a few codes with some pharmacists, and because they try to get me to experience the full aspect of what a hospital pharmacist does. I've been on a few codes where people actually, their blood pressure's dropped, their heart rate's gone. You inject them with epinephrine, try to get their heart rate going again and everything, and they actually come back to life. It's a remarkable feeling.
Pharmacy, where we're going now, is we're really working on integrating our students and getting them to work together as teams. So because where healthcare is going is more of a team-based model, and where we're really going and where pharmacy is going is pharmacists working as really the disease and drug experts and utilizing that knowledge, not just dispensers of medication, but dispensers of information as well as preventative measures.
That's what I love about the pharmacy profession. It's not stagnant, it's always changing, and just by doing the PharmD program, I will be able to, take those different paths in life.
Our goal is our students. They're the product of our program, and our job as faculty within this program is to give them a certain comfort and competence level when they go down to advanced rotations.
Teachers' doors are always open. You can always go and ask them a question during their office hours, and it makes that more one-on-one interaction that a lot of people want, and it helps them learn the material more.
There's not one faculty professor that I've met who has ever, shot me down when I wanted to ask a question or wasn't willing to help me.
Some of my professors are becoming family members to me. A lot of these professors really dedicate their life to the profession of pharmacy, so it's inspiring to be with people who are so passionate about what they do, because then it makes you feel more passionate about what you're going to do, and it inspires you to be even better. They're really like what has even pushed me forward. I didn't even need any reassurance, but somehow I just want to be a pharmacist even more.
We're the most accessible healthcare providers, and we really advocate to our students that they want to help their patients prevent problems as opposed to reacting to those problems. So that's one of the dynamic things that we do here at the college, is really encourage students to be proactive.
So our goal at MCPHS is to train pharmacy students to be leaders in the future and to really bring their knowledge and expertise and to lead the changes within the profession of pharmacy.
I would say MCPHS is great for anyone who absolutely has a passion or just is interested at all in maths, sciences, the human body, how it works, interacting with other healthcare professionals, communicating in a way that you're going to help another person.
My experience at MCPHS has really been one of the most wonderful experiences of my life, because I've been challenged, which is actually something I enjoy. I was glad that I wasn't bored in my classes. I was learning constantly.
When I graduate, I'll probably feel that even more of excitement, wow, I can't believe I've done this. This is exciting. All this hard work has paid off.
I'm so excited about my future. I have a year and a half left here at this institution to grow as a professional, and then sky's the limit.
We'd love to see you here at MCPHS in our pharmacy program. Utilize those skills, your talent, and bring it here to the college, and we'll make sure you're successful in the long run.
Toxic agent group. It looks like the cells are really unhealthy. Take a look.
Wow, you're right.
But check this out. This is the treatment group. The cells look really healthy.
You're right. I noticed that the cell processes over here and over there, they're actually gone. I think we need a second opinion though. Let me call Alla. Hey, Alla.
Hey, what's up?
Hey, so can you look at the screen and tell me what you see?
Yeah, sure.
the cells do look healthy over here and over there. So it means that the treatment reverses the effects of the toxic agent. That's amazing. Good job, girls.
This isn't a lab at a hospital, a drug company, or a government facility. It's a classroom. Welcome to the Pharmacology and Toxicology program at Massachusetts College of Pharmacy and Health Sciences.
So what do you guys think?
Well, I was really surprised by the results. PharmTox stands for Pharmacology and Toxicology.
You get two aspects instead of just one. You're studying the basis of pharmacology, which is the study of the drugs in the body, and toxicology as well, which is how the drugs affect the body.
I agree. I was definitely surprised with the effect of the treatment on the toxic agent, so that was really good.
Looks very promising.
Yeah, it's pretty exciting.
It is.
I think we have to do. What we're trying to do is teach the students where drugs get discovered and where drugs get developed so that they ultimately do enter into the clinic.
There's so much flexibility on what you can do with this major. So depending on your interest, you can apply everything that you learned here into your future career.
Everybody that's in this program has a different goal. Each person has something that they want to do.
I like anything that has to do with the urinary system.
I have a huge interest in cancer.
I really like cell culture,
The kidneys, the ureters,
anatomy and physiology,
tissue histology.
I like pee, not to gross anybody out.
The best part, I think, is to actually look at different types of cells.
My dream scenario would one day to be working in a hospital studying embryogenesis.
I know in the future I really want to work in the lab.
I like the whole aspect of drug development, and that's what you do in this field. And one day, I aspire to find the cure for a very significant disease. Helping people is definitely the core of why I got started in this. My aunts on both my mom's side and father's side have been diagnosed with breast cancer. And my aunts are the most influential females in my life right now. So that's my motivation behind my studies right now.
I didn't know anything about PharmTox before MCPHS. So I remember I called the school and I told them that I have a huge interest in the anatomy and physiology of the human body, but I also have an interest in drugs. And they told me that pharmacology toxicology program would be a great fit for me. I just fell in love with the program itself by the end of my second year. So
before I started MCPHS, I actually had an internship in a lab. I was studying how biofilms affect cystic fibrosis. I got to see it firsthand before I started doing what I'm doing, and it basically showed me that I definitely love what I'm doing.
All right. Everybody has their goggles? Goggles. You guys are excited? Yeah. I'm gonna break you up into two groups. Each group is an N of 6.
We're doing lymphocytes this week, which I'm really excited about.
So here are samples. These are the dilutions that we made last week. As I said, these are suspension cultures. All right, you can start coming in and looking under the microscope. You'll see them both individual as well as in clumps. That's how they grow. You can move around that flask if you want, just to take a look at that.
All the teachers here, especially the 3 that primarily work in the PharmTox program, no matter what you need, any time of day, they will help you. And I mean, they pretty much know what all of us are interested in as well. So they help us focus our paths.
The group is fantastic. They do an exemplary job in really learning the education, but more their enthusiasm in the laboratory, learning all the techniques that they see as relevant.
So right now I'm adding the water to the PCR reaction in order to measure the amount of RNA in the cells that we extracted earlier.
As far as the PharmTox program, I really like everybody that's in it. I couldn't ask to be around better people.
We all get along. It's like a big family, especially since we had so many classes with each other previously. So everybody adapts well, and I like everybody in the program. So I'm really happy with that.
It's pretty cool to have 9 really good friends that all do the same thing.
The school in general is a challenging school, but it does push you, and it makes you use your full potential.
You have to have really good time management skills. It's a lot of studying, it's a lot of work, but in the end, it basically trains you for your job. I'm about ready to add a reagent to the ELISA. It's going to change colors.
The Pharmacology and Toxicology program is a program that basically bridges the education that they learn in the classroom with the actual experience that they're going to gain in the laboratory. And we do this really through the hands-on experience. Now she's just putting the samples into the qPCR machine and start the program.
All the stuff that you're going to have to be trained to do in the industry, we actually do it here. So that makes you that much more appealing to potential employers.
You done? Yeah. Slide it down, and then lock it down. There you go. Science is the beginning to their ultimate career. And so whether they do pursue further scientific education or decide to go down another path, we're going to prepare them the best we can. And we're hoping that the students will be able to just sort of smoothly transition right into the real world.
Something that will just make my day. It will be a day that I can work in the lab, regular lab, do my pipetting, and take care of the patients. And knowing that I made a difference in that patient's life.
I can't wait to work that 9 to 5, so I'm really excited.
If you're interested in pharm tox, you should definitely look at MCPHS.
Take a look.
Hello, Mr. Smith. Mr. Smith, how was your night last night? Mr. Smith, he's not responsive.
Not responsive. Call the
I
code.
have no breathing. I have no pulse. Okay. Dejette, could you please compression? Okay, starting chest compressions. Oxygen.
15 liters, high flow.
Check the pulse. Still no pulse. Switch out on 5.
At the top.
5, 4, 3, 2. Switch out. You can oxygen? Oh, he has a weak pulse now. Can you check the blood pressure, please?
90 over 60.
15 liters, high flow O2. Oxygen saturation.
92.
Breathing on his own. I'll get you a respiratory rate.
And I think now everybody has done a great job. Thank you so much. Great work.
This is not a hospital. It's a classroom. Welcome to the nursing program at Massachusetts College of Pharmacy and Health Sciences.
And do you know exactly why do we ambu bag?
To help them breathe because they're not breathing on their own.
Excellent. We're giving 100% breathing, 100% oxygen, and you did a great job.
It was really intense. Even though it was a mannequin, it was like as if I was trying to save a real person with teamwork. And so it felt great when we got a pulse and a heartbeat.
That was my first kind of experience in an emergency situation. So I hope that it goes similar to that one and we can revive the patient.
I would probably get your stuff. What we really want to instill is safety before they go to clinical. So the more they practice, the better they are before they go out there.
Have your kids been in lately? No. Did you sleep well last night?
Yes.
It helps us not only prepare to take care of people on the physical level, it helps us to learn how to talk to patients and learn how to connect with them.
Okay, Mr. Johnson, your x-rays seem to be great. It was positioned in the right spot, your stomach.
You get to know them as real patients. They're assigned names. We don't refer to them as the mannequin in this bed. This is Mr. Brixby. He has a birthday. He has a medical ID number. He's to be treated as if it were a real patient in that room, who is, has a family and who's real, and who is just more than somebody lying there who needs to be taken care of.
I decided to become a nurse because I had grandparents who visited the hospital several times throughout the year, and the only comfort I ever got when I was young was through the nurses. They made me feel like my grandparents would be okay.
The alarm goes off at 5:45 in the morning. You leave the house, you're thinking about what do I need to do today, you're checking your planner, you're going over yesterday's notes,
You're reading chapters for tomorrow, getting it together for the test that's coming up.
Are you guys following me to lunch? Oh, really? Yeah. Okay. You are going to have to study hard almost every day, but also learn to manage your time and know how to have fun. Right now I'm in classes from 9 to 5. They can be really stressful at times. What gets me through are my friends and coffee. You kind of just have to learn time management to get through them. I'm about to start a new class today. They teach us about visiting nurses and clinics and whatnot. They've started, but it's locked. You have to knock.
It's challenging, it's stressful.
I got a text from my friend and he's like, remember, we need you. Doctors treat patients, but nurses care for patients.
When you're not in school and you're at home, you are always thinking about what the next thing is.
I usually come here around 7:30 and just study.
I go home and eat dinner and then I shoot back to the library till about 11.
Try to get 8 hours of sleep, do it all over again.
It's really demanding, but I'm working towards something, so.
One of the basic skills you'll learn in nursing is vital signs. You'll do that almost every single day in your nursing career.
I can insert a catheter. I know how to clean a wound. I know how to irrigate a wound.
These are to be kept above the waist as to prevent contamination.
So we also learn to do injections, medication administrations.
Change an IV.
What's your favorite procedure?
I like the nasogastric tube. Swallow, swallow. Swallow.
You like the nasal gastric tube?
Yes.
But we'll give it online instead of giving it. You did a great job. The students are my pride, and that's what keeps me going. That's what keeps me having more passion towards the profession. I just love the students.
They are a faculty, they are to be respected, but you know that you can approach them for anything.
We like to keep in mind that we were students not that long ago.
I can honestly say I would not pick anywhere else to be. The professors, my fellow students, it was just a complete package for me.
We adopt the clinical immersion model. After the theory, they will be immersed in the clinical areas for about 3 days per week. In that time, they will apply the theoretical information.
We like to remain approachable and available at all times so that they can become as close to proficient as possible before they have to go out.
My husband and I have 5 kids, and of course we're very proud of them and their successes. And it's the same sort of feeling whenever a nursing student finishes the nursing program. I couldn't be any more proud than if they were one of my own children.
I chose this program, nursing, because it's exactly what I want to do.
I am chomping at the bit for my future.
It is a lot of work, but my main goal is to finish and know that I am helping people at the end of the day.
I want to get out into the real world, and I want to start making a difference.
Challenging, rewarding, exciting. Just another day at MCPHS.
The nursing program at this school is a fast-paced, invigorating program.
You're always thinking on your feet. You always have to be one step ahead.
We have eliminated unnecessary content, so our students really can focus on what do they have to know to pass the national licensing exam.
One of the biggest things I'm trying to get from this school is definitely confidence and technique, because if you don't have those in a work field, you can't really, survive.
Traditionally, nursing was actually taught in the hospitals, where there was a lot more hands-on. Then we moved into the universities, and we lost a lot of that hands-on.
You can simulate what's happening in the real world in a nursing lab. And so that's why many of the students get to clinical and they're just like, been there, done that. I've seen this before because this is what we do in the lab.
We set these mannequins up as a real patient. They have a real name, they have a real medical ID number, date of birth. We program them with certain vital signs and situations that we can place it in. And a lot of the things we roll through are those key fundamental skills that you need and you're going to use in every aspect of your nursing career.
The sim mannequins, they can have a pulse, a heartbeat, they have respirations, and we can take their blood pressure.
Our lab mimics a hospital. We have the pumps, we have the medications.
All of the staff here have been nurses for years. We have a lot of experience. We bring in scenarios that may have happened to us, and we tell these stories to our students, but we also write them up in simulations.
We can practice giving injections on the mannequins before we do it on a real person.
One of the things that we do for a teaching strategy is peer teaching.
The seniors are actually in the lab with the 200 level students, and they're serving as peer tutors to them.
We've taught them well enough that they are confident in their ability to peer teach.
We get to collaborate with each other and kind of feed off of each other.
They learn to be an educator, to be a mentor, to be a leader.
I have so much support here, whether it's my friends I've made, whether it's professors. I'm actually a peer mentor too, so I find that mentoring younger students kind of makes me feel supported in a way. It's really great because it's a small community kind of thing, and the professors, you know, they all know your name. They'll email you directly if they feel that you need some extra work. It's very diverse here. You walk around and you see people from around the world. Yeah, it feels like a small community, which that's something I loved, coming from a small community myself. I really appreciate all of the work that the professors and faculty have put into, you know, our future.
If you want to be a nurse, this is where you should go.
The growth from day one to now, where I'm sitting here and graduating in 2 days, was exponential in 32 months. It was incredible.